Hi, I'm Dr. David Hill, and today we're going to be talking about relieving pain associated with scoliosis in children. The first thing to discuss is, what is scoliosis? Well, scoliosis has many different causes, but what it describes is an abnormal curvature of the spine. Now, some scoliosis may occur as early as infancy. However, most commonly we find scoliosis in the teenage years, during adolescence, usually in young women, much more commonly than in males, although male adolescents may also have scoliosis. Usually scoliosis is not a particularly painful condition. It's usually diagnosed at a child's regular wellness or physical exam. The parent may have noticed some sort of hunching of the back or some unevenness, and usually at the annual wellness exam, the doctor will have the child bend down and touch his or her toes. When the doctor sees an unevenness between the two shoulder blades, that's a great indicator of scoliosis. Pain is rarely associated with scoliosis, but any back pain deserves full and adequate evaluation. If a doctor suspects scoliosis, the exam is helpful, but you really can't tell how bad it is without doing x-rays. X-rays for scoliosis will allow the orthopedic surgeon or radiologist to determine exactly how severe the curvature is. Often for mild curvatures, no intervention is needed. If the curvature is more severe, a sort of brace called an orthotic may be made to help rotate the spine into a more natural position. Wearing the brace may be uncomfortable, and your orthopedist or physical therapist may suggest some exercises or stretches that help as well. For musculoskeletal pain, we usually rely on ibuprofen. Most commonly, that's what's in Motrin or Advil, because it seems to help the best, although Tylenol, acetaminophen may also be helpful. So remember, scoliosis is not usually diagnosed by pain. If your child has significant back pain, he or she needs to see a doctor immediately to evaluate what might be going on. If your child does have scoliosis, an appropriate evaluation with an x-ray and often a consultation with an orthopedic or spine surgeon would be very helpful to determine whether any treatment is necessary at all, or whether the child is likely to grow up fine and never suffer any problems from it. Talking about relieving pain from scoliosis, I'm Dr. David Hill.